An increasingly common question or questions that I get from people in my practice now is regarding biologics or sort of quote unquote stem cells. This is right now the frontier of our field, and I've been involved in some research looking at some of these elements. I think this is these sort of biologic agents, and when I say that, I mean things like autogenous agents like platelet-rich plasma or bone marrow concentrate, which has stem cells in it. There are some systems available for the use of adipose tissue as a source of biologic agents, and then also kind of donor products like amniotic grafts. All of these things have some combination of cells or growth factors which we think may be beneficial for healing or promoting kind of a positive biological environment at the site of injury or surgery. In our clinical practice, the most common modality that we'll use is platelet-rich plasma because it comes from the person who's going to receive it, and there is a good emerging body of literature supporting safety and a lot of cases efficacy. In my surgical practice, we will also sometimes use bone marrow concentrate as a source of both mesenchymal stem cells and additional growth factors, particularly at surgical sites, for example, to augment rotator cuff repairs, or in some cases ACL reconstructions or meniscus repairs, et cetera. One of the challenges, though, is that there's still a great deal of work to be done to understand what are the best applications for these therapies and how to predict who's going to respond really well versus who isn't. And so there's a lot of work still to be done. You know, one of the other challenges is that there's an increasing number of allogeneic or donor products that are available, and some of them we just don't know yet how well they're going to work. This is, you know, very, very sort of promising. And so if you have an interest in pursuing those strategies, then please come in and we'll talk about more of them and talk about what may or may not be kind of appropriate or helpful for you.